journalism.
The weather is getting colder. That could mean trouble for COVID-19 case counts. In some parts of Northern Ontario, such as the Soo, they're already spiking. Tonight, we'll find out why with Algoma's Medical Officer of Health. Then, from our Ontario hubs, we get an update on the resumption of service on Ottawa's LRT. And from making the Great Lakes smarter to building affordable housing, we've got the agendas we can review. It's Friday, November 19th, and that's ahead on the agenda. Here's what you don't want to hear in a press release issued by local public health. Transmission is occurring throughout the community in workplaces, schools, sport and recreational settings, healthcare settings, and within vulnerable populations. But that is pulled directly from communications from Algoma Public Health this week, as cases there are surging. With us for more from Sault Ste. Marie, Dr. Jennifer Liu, Medical Officer of Health for Algoma Public Health. Welcome.
Thank you for having me.
Dr. Liu, thank you so much for being on the show. I know you're pretty busy. Just before we start our conversation, when we talk about Algoma Public Health, what are some of the main population areas aside from Sault Ste. Marie?
For sure. So Algoma Public Health covers a large area in the northeast of Ontario. Our service area is essentially between Thunder Bay and Sudbury. So we work with 21 municipalities, as well as 8 First Nation communities whose territories are the land of the municipalities that we serve. Some of our communities are a few thousand people, like Elliott Lake, 10,000, Blind River, Wawa. Some of our communities are much smaller. They have a few hundred people. And for those of you not very familiar with Northern Ontario, so if you were in Toronto and wanted to fly to the Soo, it's a very quick, about 1 hour flight, because you just cut right across and fly diagonally northwest across the lake. If you're driving up, don't know how far you've ever gone up. It's a bit longer. Yeah, it's about a 7-hour drive to get to the Soo. If you're driving from Toronto, go north, head up the 400 until that stops and keep going past Barrie. Once you hit Sudbury, you head west, and then that's when you eventually get to Algoma and you hit some of our municipalities, just skimming along the north shore or the north channel of Lake Huron. And Sault Ste. Marie, our biggest municipality with about 74,000 people, that is nestled just where some of the Great Lakes meet, Lake Superior, Lake Huron, and Lake Michigan.
So a very beautiful area, a very diverse area, but your public health region is currently grappling with one of the highest rates of transmission within this province. Can you give us a snapshot of what's happening there?
For sure. So right now, we have just over 230 active cases with about 15 people who are hospitalized. The vast majority of our cases and transmission has been happening in Sault Ste. Marie. And to give you some sense and context of those numbers, throughout the pandemic, a total number of cases that we've had is around 800. So what we're really seeing is that about a quarter of our total cases have been happening within the past couple of weeks. And that has been a huge surge. If you remember that color-coded framework from last year, a 7-day incidence in the 50s would put you in the red zone. Our 7-day incidence most recently has been 130. So we're way above that. And that has been a tremendous impact on our local ability to keep up and manage these cases and do contact tracing.
I read part of that press release, and it's very shocking. Are you alarmed with what's happening right now?
I think all of us, as we headed into the fall, were gearing up for a potential resurgence of the virus. And, obviously you prepare for the worst. You hope it doesn't happen. But what we're seeing right now is not particularly surprising. We know that as restrictions ease, people want to go back to normal. It has been a very, very long pandemic for all of us. And as soon as people get a signal that things are improving, we want to go back to all those activities that we used to enjoy and have lots of visits with one another and friends and family. Unfortunately, the virus is still circulating. It is the Delta variant, which is very transmissible. And when we have people becoming a bit more complacent with things like masking and distancing and having more social contacts, put that together with colder temperatures and people moving indoors, that's when we have a bit of a perfect storm of transmission. And that's what we're seeing as well. Here in the north, obviously temperatures drop a little bit sooner than in southern Ontario. We have snow on the ground right now at this moment in the Soo. So all of those factors combined together have been driving this current surge.
What is the vaccination rate in your region?
Happy to say that immunization has been really successful here in Algoma. Just last week, we reached the milestone of over 90% of eligible people having gotten at least their first dose, and over 86% of people eligible are fully immunized here. Over the past weeks, we've continued to provide third dose boosters as well as first and second doses to people. And we're reminding folks that, now is the time to get immunized if you want to be fully protected in time for the holidays. It's just 5 weeks out now.
Are the majority of the people who are getting COVID now, are the cases amongst the people who are unvaccinated?
Yeah, so what we're seeing is that the majority of cases at this time are people who are not yet fully immunized. About 65% of our current cases in this fourth wave have been people who are not yet fully immunized, and about 35% of our cases are amongst people who are fully immunized. We know that the vaccines provide really good protection against severe disease. And again, of the people in hospital, based on what we're seeing with our hospital partners, about 75% of people hospitalized with COVID right now are those who are not fully immunized.
I read too somewhere that people are being told not to visit people at hospitals. Is that happening right now?
So at this point in time, Soo Area Hospital, which is our major tertiary care center, has put some visitor limitations in effect. Again, this is to protect patients and to protect staff as well. We are in a situation where there's more community transmission. So there's certainly small exceptions where visitors are possible for compassionate reasons or for certain health situations. But for the most part, visitors have been restricted in the hospital setting.
What is your capacity in terms of hospital beds?
So I don't have that number offhand. Happy to get it for you with our hospital partners. But again, in close conversation with them, staffing capacity and beds are stable right now. However, some elective procedures at the local hospital have been rescheduled. We haven't reached the point yet where we are, canceling surgeries, but certainly that's what we want to prevent. We don't want to disrupt healthcare services to our community. We want to protect them and preserve them, and the best way to do that is to make sure that we curb the current transmission.
We talked a little bit about why cases might be going up, because it is getting colder. You already have snow on the ground, but your region was relatively unscathed by COVID last year. So what would you say are the key factors behind this outbreak?
Absolutely. So I think that right now we are in a situation where people have enjoyed a wonderful late summer and early fall. They've been able to do some traveling, visiting, doing all the activities that used to be normal before the pandemic. And the more we do them, the more we see one another, the more complacent we can get. We tend not to distance or mask anymore. And even in the workplace, restrictions have been gradually being lifted throughout the fall. And again, this is what we wanted to do, but obviously things change when the temperatures drop. And once we have people doing a lot of socializing and having unmasked close contact indoors, this is when the virus starts to spread. And I think the other piece is some misperceptions around the protection of vaccines. Vaccines provide great protection. If a person gets infected and they're fully immunized, chances are they're not going to have severe disease. And if they're otherwise healthy, they're not going to end up in the hospital. But the vaccines don't make us invincible, right? And so, what we're really trying to tell people is that if you've been fully immunized, fantastic, and thank you. And you can still have a mild infection and spread that infection to others. So we're really urging people at this point in time to take note of those mild symptoms. Don't brush them off and then take yourself to work or school. Get tested and stay home if you're sick.
As you've mentioned, it's been this pandemic has been very long, and vaccines are not just the one tool that we have in our toolkit. From your vantage point, were businesses following health and safety protocols by enforcing masking, social distancing, and so forth?
Absolutely. I think vast majority of businesses have had their safety plans in place and good solid policies and procedures, including vaccination policies. Lots of our local businesses have been implementing those with great effect. Again, at the end of the day, though, even if you have a fantastic policy and solid procedures on paper, it comes down to what's happening in reality with human behavior. And as we know, in public health, human behavior can be really challenging to change. And sometimes it takes time, it takes repeated efforts. But this is bread and butter public health, right? Whether it's smoking or eating healthy or exercising or drinking habits. These are the kinds of human behaviors and health behaviors that we're always working with our local partners to try and manage. And sometimes it's a combination of education and training, posters, setting up the physical environment so that you're by default distancing. And sometimes it's a matter of enforcement as well. So we use all these tools in public health and work directly with a lot of our local businesses to make sure that as much as possible, they stay open and stay safe.
Because some businesses, if you're especially in the public sector, have required people to get vaccinated, but some private businesses haven't. Algoma Steel Mill in Sault Ste. Marie doesn't require workers to get vaccinated. Do you think that played a role in this surge?
Sure. So I think that absolutely, when you have a strong vaccination policy in place at the workplace, it can encourage people to get immunized. And we continue to work with a lot of our trades and similar workplaces to see if they're able to put policies in place to encourage immunization. But sometimes that's challenging as well. And there are other ways too that we need to look at assisting people to be able to wear proper PPE, follow protective measures when they're in the workplace, not gather so much, and again it comes down to immunization and all these other protective behaviors.
Given your proximity to the U.S.-Canada border, do you feel that the border reopening might have played a role in this?
Yeah, so as a border community, we've always been acutely aware of what's going on just across the river in Sault Ste. Marie, Michigan. We know that a lot of essential workers have continued to go back and forth and have been able to do that throughout the pandemic. Some local healthcare workers commute to work at the hospital across the river in Michigan. We have students who live in Sault Ste. Marie, Ontario, attending Lake Superior State University. And, as the border has reopened, this back and forth certainly has gone up. And as part of our overall messaging to the community, we're always making people aware of what the COVID situation is like just across the border. In the past weeks, the Upper Peninsula of Michigan certainly has seen high rates of COVID as well. And we're making sure that people know that and know their risk before traveling, to make sure that they keep their masks on and they keep their distance in these communities, even if there's not a lot of rules there, as there are still here.
I know you've been working hard throughout this pandemic, and I think a lot of people have been looking forward to the holiday season, and now with numbers going up, what is the mood in your region? Is there a sense of frustration that this is where you are now?
I think obviously there's a huge amount of fatigue with this pandemic. People really crave that normalcy, and we remember the challenging times of last year during the holiday season when there were very restrictive lockdowns in place and you could not really gather with friends and family. The purpose of the entire pandemic response has always been not just to limit severe disease and death, but also to limit societal disruption. So the actions that we're urging people to take now are really so that we don't have to take even more restrictive actions down the road, and especially, during the holiday season.
What are those
We
actions that you're taking now to curb the spread?
For sure. So last Friday, we issued a very strong, clear message to our local communities, asking everyone to take three key actions. Number one, get vaccinated. Number two, stay home if you're sick, even if it's mild symptoms, even if you've been fully vaccinated. And number three, cut down on those unmasked, unprotected, close contact interactions with one another. We have, in the north, a very good culture of dealing with winter. Winter comes every year. It's never fair, but it does. And, every time there's a huge, giant snowstorm with 6 feet of snow, we don't see speed limits go down. What we see are people driving according to conditions. And this is exactly what we need everyone to do right now. Surges of activity can hit communities at any point in time, and people need to be aware and adjust our behaviors accordingly. So now with this giant surge, now is not the time, to have a packed social schedule, full extracurriculars every day of the week, plus evenings and weekends. Now is the time to cut back, pause and postpone those non-essential gatherings until transmission is lower. So those three things were the main key actions that we're asking everyone to do right now. And as you'll noted in this Monday, the health unit also took some action. We issued a class order section 22 requiring isolation on a legal order. We encouraged Sault Ste. Marie businesses through a letter of instructions to essentially instruct them to reinstate capacity limits that were recently lifted and put back physical distancing on their premises. And we also now require anyone 12 plus participating in indoors organized sport to demonstrate proof of vaccine. So the health unit did a number of mandatory measures in our region, and at the same time, we're asking every resident and community member to do their part and slow down, cut back on close contacts.
One of those action items that you mentioned is for as many people to get immunized as possible. And this Friday, Health Canada authorized the Pfizer vaccine for kids aged 5 to 11. Is your region prepared to roll out the vaccines for that age group?
Absolutely. We have been waiting and very excited to hear that the approval of the Pfizer vaccine is now here for 5 to 11-year-olds. And our clinics across our district, across our 21 municipalities in that 7-hour drive, we have been working really hard with partners over the past few weeks to prepare for this moment so that as soon as we receive that vaccine product, those pediatric formulations, we will be able to start rolling them out and administering them to our kids. We did a survey actually a few weeks ago just to see what the preferences are of our parents. And it looks like, people prefer a variety of options. There are some who really want to get it done in their doctor's office, some who like the community clinics, and we're making those kid-friendly for the next few weeks, and some who like the convenience of pop-ups and drop-ins. So we'll have some school-based clinics after hours. We'll certainly have community clinics, and we have many pharmacy partners and primary care partners as well who are offering in their clinics and offices.
In our last 20 seconds, I know you're from southwestern Ontario. A lot of people from here will probably be coming up there for Christmas. What do you say? Or are you even concerned about, maybe that will make the situation worse?
So again, I would say that now is the time to drive according to conditions. Keep an eye on what COVID activity is like locally where you are right now and at your destination. We want to make sure that people remain safe over the holidays while they're gathering with loved ones. And now is the time 5 weeks out to take additional precautions so that we avoid a worsening surge and we have the ability to gather.
Dr. Liu, thank you so much for taking time to speak with us. We know you're very, very busy, and we wish you all the best during this challenging time. Thank you so much.
Thank you, Nam.
Last week, service resumed on the Confederation Line LRT in the nation's capital. It's been quite a ride, so to speak, for the light rail transit system. With us now to explain, Sarah Trick. She is an Ontario Hub's editor, and she joins us now from Ottawa. Hello, Sarah.
Hello, Jan.
All right, so let's quickly go through sort of the timeline of the LRT project. So the project started in December 2012. The Ottawa City Council approves the project that year. Construction would start in 2013, September 2019. Whole 6 years later and a whole year overdue, the Confederation Line launches. Less than a month later, October 2019, multiple service disruptions due to technical issues occur. Between 2019 in December to 2020, there are a number of technical issues continue. Fewer trains are in service as well. And then we move into 2021. August 8th, 2021, the first of derailments. An empty train derails, no injuries, thankfully, in that one. September 19th, 2021, just a month later, a train derails, damages hundreds of meters of track. Service is suspended. Dozens of people are in the train, but thankfully no injuries there as well. And we move on to November 12th, 2021, several months later. Partial service resumes. This was just last week. And then just this week, November 17th, 2021, the Ontario government announces a public inquiry. A very busy timeline for this light rail project here. Sarah, let's break it down a bit. This project has a price tag of about $2.1 billion, has lots of issues. Let's start off with the first one. Why was it delayed a whole year?
Well, Jan, there's no single response to that. Some background here. So the train was built and is being run by a consortium of transit companies that's operating under the name of Rideau Transit Group. So Rideau Transit Group had to construct the trains, and then they were supposed to hand it over to the city of Ottawa, after which the city of Ottawa was going to complete its own testing. So there were a lot of issues with the actual construction. I think the biggest one was the sinkhole that happened in 2016. It was a massive sinkhole underneath Rideau Street that opened up there and really delayed the construction of the underground tunnel. Rideau Transit Group at one point wanted to perhaps go toward a partial opening of the line, but the city said no, that they wanted a full line opening. There were also missing parts and just other delays.
So let's talk about sort of, there was lots of excitement with the launch of the transit system here, but it was only a few months later that there were technical and mechanical issues. What were some of those issues that sort of led to the chaos that a lot of us have seen, sort of those photos of large crowds packed on sort of the outside waiting for trains?
I'm going to correct you there. It was actually a couple weeks. So what happened was, for the first couple of weeks that the train was in service, everything seemed great. But at that time, there were also parallel bus routes still running while people got used to the train. So people could take the bus or the train to wherever they had to go. And then after a couple of weeks, when everything worked smoothly, the city took those parallel bus routes off the streets. And the idea was that everybody would use the O train after that. Basically, in the next couple of days after that, which I think was October 6th, there started to be issues with the doors. So the doors were on a timer, as I understand it, and then if people tried to open the doors, it would basically stop the train. It would freeze it. They were euphemistically referred to as door faults. And that would bring the entire system to a halt, basically. So during that week, there were issues with the doors, there were issues with the computers. The issues with the computers continued. And then once the door issue was fixed, there were issues with the trains driving that winter. What was supposed to be special about these trains were that the trains were specifically designed for North American winters. It was like an update of an older model that allowed for winter conditions, and it was specifically designed to work in Ottawa. So everybody was really excited about these trains for that reason. But then the train computers couldn't, the trains couldn't go through snow. The switches on the trains would freeze, things like that. And so there was a lot of technical issues surrounding that winter.
Now, derailments are fairly serious events. I'm curious about the most recent one, the one in September. What exactly happened in that case that caused, the train to completely fall off and damage hundreds of meters of track?
On the September derailment, the train came off the tracks, traveled in a derailed state, including over a bridge, and then eventually came to a stop when it collided with the with the signal box. And in that case, the train was out of service for 54 days, and it came out in a Transportation and Safety Board report that the second derailment was due to, and I'll quote here, inconsistent and incomplete maintenance following the first derailment. So maintenance procedures were not logged correctly, and certain procedures that needed to be done after the first derailment were not completed properly.
So, Sarah, the Ontario government just announced a public inquiry. What can we really expect from that, and what should we know about it?
I'm not sure what to expect from that because the parameters of it have not been announced as of now. I do know that there have been a couple of motions in City Council for a judicial inquiry, both of which have been defeated, partially because of the amount of time that such an inquiry would take. The provincial inquiry will not have the same scope as a judicial inquiry would, but I guess it's hoped that there will be more answers brought forward by it.
Well, we'll keep an eye out on that. And as we know, service resumed just last week, so I know a lot of people will be looking at that as well. Thank you so much, Sarah. Really appreciate it.
Thank you.
The agenda this week learned how technology could help protect the Great Lakes, examine the state of extracurricular activities for Ontario kids, heard why dentists are concerned about who's getting treatment, and consider the trouble with global supply chains. The agenda's week in review begins with whether inclusionary zoning could help get affordable housing built.
I want to start, I guess, with just a bit of a fact file to bring our viewers and listeners up to scratch on what IZ inclusionary zoning actually is. For example, as passed by Toronto City Council, it means that 5 to 10% of condo units built around designated protected major transit station areas, those units would need to be affordable. And the range has to do with where it is in the city. So the highest percentage being downtown, the lowest percentage Scarborough Centre. That would increase to 8 to 22% of units by the year 2030. What does affordable mean? Well, affordable in this case refers to targeting households making between $32,000 and $91,000 a year. And of course, depending on the size of the unit, it could cost $800 for a studio monthly to $1,850 a month for a 3-bedroom. And affordability must be maintained for 99 years. That's the 411 on IZ. And now we want to get some feedback on what you folks think. Lori, we're not the first city to try this. There have been other cities to try it, but we're the first in the province of Ontario to try it if it in fact happens next year. What do you think about the effort Toronto's put forward here?
Well, first, before I answer your question, I just want to say that I've been working with the building and land development industry for the last 6 years, and we absolutely support creation of affordable housing and inclusionary zoning. To answer your question, what we don't support is the Toronto program. And the reason for that is, unlike any other city across North America, Toronto has done a program where the full cost of those inclusionary zoning units is borne by the new home buyer. There is no financial offsets or incentives for the developer to provide that unit from any of the levels of government.
So, in other words, if this were a social good that governments thought was important to achieve, they should be putting some money where their mouth is.
Absolutely. This is a societal responsibility. We as Ontarians all have a role to play in creating affordable housing.
Okay, that's Lori's view. Garima, you want to come in here and tell us what you think about that?
Sure, absolutely. You know, I find Lori's comments really interesting. In my view, the debate about inclusionary zoning is a debate about who belongs in the city of Toronto. And so far, you know, we like to think that Toronto is this welcoming place where people from all walks of life can live, work, and play. But what we've seen over the past several decades is that people with modest incomes are being pushed out. And so, you know, in response to what Lori is saying, that, you know, the cost of new affordable units being spread out to other new home buyers who won't be living in these affordable units, I think is a bit of is shining a light away from the reality of how costs are being distributed and what the analysis behind inclusionary zoning has held constant in terms of which variables will change. And so, you know, developer profits aren't one of those variables that will change as a result of inclusionary zoning, and market analysis that the city has undertaken has held that. And
okay,
so
hold there,
is a
Garima.
decision point. Yeah,
Got
sure.
you there. Okay, we'll dive into some of those items that you brought up as the discussion continues. Mark, how about your take on this particular IZ effort by the City of Toronto?
We spoke at council, and we are generally supportive of the moderate way that the city is trying to approach it. Inclusionary zoning is not Viagra. It's more like insulin. You need to moderate the dose and make sure you're doing a bunch of other things. Check your blood sugar, eat right. The city has tried to create a program here where they're not really putting any skin in the game themselves. And that makes it hard to create affordable housing units at the speed and scale we need to in the city of Toronto. They have other programs like Housing Now, where they are generating more units faster because the city has skin in the game.
Mark, I think I get your metaphor, even though we are a family program, and I think maybe you could have chosen a different one, but that's another story. Anyway, moving right along here. Okay, Josh, I've purposely left you for the end because I wanted you to hear what everybody else had to say about the city's efforts. You were obviously involved as a Toronto City Councillor in the debate. How do you line up on this?
Well, you know, the development industry has proven that they will price what the market can bear. And, you know, many cities throughout North America have inclusionary zoning policies that have percentiles that exceed Toronto's. So, you know, this is, if anything, a cautious start as far as what we're doing. Toronto's been asking the province for several years now to allow us the tool to use inclusionary zoning. And the reason why is because I, along with my colleagues, hear, without exaggeration, every single week from residents who cannot afford to live in the city, are being priced out, have given up on their dreams for home ownership, and struggle to even make rent. What your backgrounder didn't say earlier was that along with the condos, there's also going to be a small percentage of purposeful rental that will also be part of our inclusionary zoning policy. But inclusionary zoning is one tool in a much bigger toolbox that we need to use to be able to address the housing crisis we're experiencing.
You know, as we think about the region, it's home to 107 million people across the Great Lakes mega region. That's 8 states and then the provinces of Ontario and Quebec. It's a significant regional economy that represents roughly 30% of Canadian American economic activity and employment, or 52 million jobs. But at the heart of this region, as we know, are the 5 Great Lakes. 21% of the world's surface fresh water, 84% of North America's surface fresh water. In fact, it's the largest freshwater system in the world, supporting every aspect of our natural environment and our way of life. But it's a finite freshwater system. Only 1% of the waters of the Great Lakes are renewed on an annual basis by precipitation, runoff, groundwater. And as Kelly mentioned, it's under tremendous stress from rapidly changing climate to invasive species chemical, plastic, nutrient pollution to increased urban sprawl. What's troubling is that the environmental stressors we face are growing at a rate that is outpacing our ability to understand them fast enough, limiting our ability to sustainably use this resource and to protect our environment for future generations. We think that the Common Strategy for Great Lakes, for the first time, sets out a binational roadmap that we think is necessary for solving these issues across the Great Lakes in order to, really develop the information systems that will improve the way people learn about and respond to environmental change, how we inform critical policy and management decisions, but also how do we accelerate science and innovation as it relates to the Great Lakes.
Well, let's find a little bit more out about this roadmap. Aaron, smart technology in this case specifically means what?
Well, it means a lot of things. There's certainly been a real increase in the technology that we have available to us. And because of cellular networks, because of satellites, we also can now make that real time. And there's been a real push to be able to put equipment out in the water, like buoys that float and have sensors on them, or, autonomous vehicles like gliders that move through the Great Lakes and the oceans for that matter. And so all of these equipment are out there collecting data continuously, which is a really important point. In the past, when you wanted to study something like a harmful algal bloom, you had to go out on a boat and collect water. And so your sampling is both temporally limited and spatially limited. Now with all these new technologies that just sit in the water and collect the data, you get these continuous data sets. But it also, as Kelly was kind of alluding to, uploads it directly. So you can look at that data at any time. And so that helps us monitor things, get continuous data. We can actually react to stuff. And so that's really where the big change has been technologically. So this vision of having a smart Great Lakes, we now have the infrastructure and the instruments to do those kinds of things.
Aaron, follow up on that if you would. Give us a real life example whereby you got some information, it was uploaded to your smartphone or your computer or whatever, you found something out that was really helpful to you, and therefore you did something. For example.
Yeah, so we actually have a large project right now that's being funded by the Union Water Supply here in Leamington. They provide all the water to Southern Essex County and the greenhouse industry in Southern Essex County, which is the largest in North America and one of the largest in the world. So when they're taking water in, I don't think people realize how complicated treating water and providing it to the public is and how important it is. If there's a sudden shift in temperatures or even pH, or turbidity, or if there's a harmful algal bloom, they need to know that as soon as they can, because they can make changes to how they're delivering the water, how they're treating the water, how much water they're holding back. So we have NSERC funding from the Canadian government that has allowed us to put buoys out there, and we work directly with the water management, and they look at the data all the time. So we have buoys out there. They can go online on their cellular phone or through a computer and keep an eye on what the water temperatures are. And we have buoys further away that sort of give them an idea if there's water coming in from the central basin that might be low in oxygen. They know it's coming, they can make changes. So there's a on the ground affecting people's lives example of how that technology can be so powerful.
Gotcha. I read Mark and Kelly's report, and I note right high up in the report is an acknowledgement that for thousands and thousands of years, Indigenous people who have lived in and around the Great Lakes have been excellent stewards of them. And Barbara, I guess that's where you come into this conversation. What role do you see as Indigenous people playing in all of the efforts that are underway here?
Well, Steve, as you said, the Anishinaabe and the Haudenosaunee confederacies and other Indigenous nations have been living in relationship with the Great Lakes since the time the lakes were formed, right? And long before colonial and political borders were drawn. So the Indigenous knowledge or traditional ecological knowledge that our communities hold is very deep and very broad and based on 10,000 years of observation and lived experience with the beings of the Great Lakes. So when you start to bring in this Indigenous ecological knowledge, you start to get a bigger picture and a deeper understanding and kind of different data than smart technology can access.
You're in Manitoba. How are extracurriculars being handled there?
we're basically fully operational in our system here. There's, of course, constraints to some activities, but we had a full outdoor-indoor complement, which I'm sure is happening in some schools in Ontario as well. But most programs, because we have staff in Manitoba like George, those people can then do the homework to do the necessary thinking on how to have adequate safety for their children. And that then permits the physical activities to occur. Most principals, maybe superintendents, often create a notion of surplus safety, which surplus safety is a terrible notion. And again, I can see George and Michelle shaking their head. Surplus safety harms children because it may stop some immediate small things from happening, but it prevents all of the benefits downstream. So adequate safety in this mindset is what we need, not surplus safety. Not safe as possible, safe as necessary.
George, I saw you nodding your head there. And, you know, there are some schools, I know for my kids' schools, they don't have any extracurricular activities. First of all, I wanted to know why you were nodding and, you know, why are these activities not being prioritized by the TDSB?
Sure. So the nodding was due to frustration, but it's also a challenge. We have to provide opportunities for our students and for children, as Dr. Kralars has indicated. You know, the research there, it goes on and on. But we have to do that in a safe and caring manner. And I believe we have done, and we have given opportunities. What we need to also focus on is letting parent guardians, letting administrators, letting senior staff know that, hey, we've abided by the Ministry of Health. We've abided by Toronto Public Health. We've abided by the sporting organizations. Here is how we're moving forward. And how we're moving forward isn't necessarily how it was. There are some great takeaways that we can take from the past 19 months. And we've learned from that. But we've got to let parents and guardians know that in order for their children to reach their academic potential, they need to be active. Mm-hmm. Every parent wants their child to be safe, to be healthy. But in order to do so, they need to have that physical literacy. They need to have that those physical opportunities to be active both during the day at school and afterwards.
You used the word frustration because when the school year started, the province said that extracurricular activities could return, but then Toronto Public Health said not so fast. And then around, I think, September 20th, they said that it was fine. Is that the frustration that you're talking about?
Absolutely. And then this frustration stems from the Ministry of Education will put out quite a bit of information, but we'll say, well, you know, you have final decisions reside with your local public health agencies, and working with our local public health agencies like TPH, incredible staff. But we also have 600 schools, and then to implement things, we can't have decisions made the day before school starts. We can't have decisions made on September 20th and expect a turnaround of September 21st. So being aligned has been one of the difficulties. Having schools like the independent schools in the city of Toronto who do not have to abide by the local public health and have to abide by the provincial, then it has parent guardians saying, how come this school is allowed to offer things, but the Toronto District School Board is not? And explaining that to the parent guardians of our 250,000 students is a little bit of a tough task.
Well, would you say then that the Toronto Public Health has surplus safety?
I think they don't. They are the specialists in their field. We're the specialists in education, and I think there needs to be further discussions together.
Michelle, I saw you nodding as well.
Yeah, I echo both. And I think another part of the puzzle that sometimes gets missed is that we have unions as well. So you have unions, teachers' unions that come into play. So we've got boards of education, we've got the Ministry of Education, we've got our public health units, and then we have our unions. And at times, and still happening, those four people are not speaking to one another. So this leads to where George and I sit. We are the communicators to our communities, to our athletic directors, to our coaches. And so we are taking all of this information in, ensuring that we have safe environments for not only our students, but our coaches and our officials as well. So we are trying to mitigate all of those risks while taking into account all of the different people that come to the table that don't seem to be talking to one another and aren't aligned with one another. So I felt like it has been a balancing act from the beginning. And I'm very, very thankful for the other Ontario athletic coordinators that we are on, a group together where we are trying to navigate and stay ahead of the curve to be able to communicate the most accurate information that we have at this time.
Dr. Khalid, you presumably had to incur additional costs when the pandemic hit. Can you explain to us how that pandemic affected your practice?
In so many ways, to be honest. Number one, if you want to talk about additional costs, yes, we've sealed our operatories, our rooms, air filters, increased costs in PPE. So the average dental practice may have incurred costs of $20,000 to $50,000, let's say, in the initial capital improvement and then running costs. So our costs have increased, and Dr. Heidegger's right. The Ontario Dental Association does a good analysis. By the way, we actually submit anonymously, I suppose, our actual financial statements to the Ontario Dental Association, so they're not making up these numbers. They actually look at our actual financials, they look at our profit and so on, and so their analysis is quite rigorous. I must say there's a couple of things that I just want the listeners to take note of. Number one, dentists do have a responsibility to the public, and we take this responsibility very seriously. Someone told me the other day, he said to me, why don't you guys go on strike? Just like, in a sense, the optometrists are trying, I won't say they're on strike, but they're limiting their access to care, perhaps rightly. We can't. During the 3-month period when last year, or those 3 months, April, May, June, when we were somewhat closed, my office was one of the few offices open. We saw significant dental problems. I mean, people who couldn't eat, people who couldn't sleep. We diagnosed 2 oral cancers, abscesses. So we take our job very seriously. Dentists do have a responsibility to the public, and they are well aware of that. But we just feel that it may be better for the public in a couple of different ways, in many ways, if their remuneration was increased finally after decades. Someone told me that the Ministry of Health will spend $5 to $10 million on treating dental emergencies in hospital emergency rooms. And I thought, that's interesting. That's a big number. If they realized that patients who aren't being seen at their private dentists go to the dental emergency, go to hospital emergency rooms where they receive some care. If that funding was removed from the Ministry of Budget to the hospitals and added into this program, it would probably get a much bigger return, for example.
Right. Well, first of all, we appreciate your conscientiousness staying open during that time, and I'm sure many of your patients were extremely grateful. I do want to know how did you assume a $50,000 unanticipated cost to improve your working circumstances as it related to the pandemic? That sounds like a big nut to have to crack.
In my particular office, it was $25,000. There was government grant assistance, as you may recall, for small businesses.
And you were eligible for that?
Yes, most of it's loan. I believe it's paid back over the next couple of years. First of all, the cost, as the others have noted, of PPE, a box of gloves, for example, used to cost us $25 for one of those boxes. It hit a cost of $72 during the high point of the pandemic, and we needed more of them, not less of them. Prices have come down, though, with the world kind of improving, but there is added cost. There is added cost, and again, dentists, as all the listeners know, do have above average income, generally speaking, so no one's really complaining from that point of view. We just feel that 50% of the fee is cutting it pretty tight. And as Dr. Quinones said, if it hits 70, 75%, I think more and more dentists will accept it. By the way, as Dr. Heidegger said, maybe 50 to 70% of dentists do accept public monies for treating patients, but a far fewer number of dental specialists will. It's probably closer to 5 to 10% of specialists will accept these programs. So that also limits care.
So if I understand you, dentists don't mind taking a haircut on the fees. They just don't want to take a huge haircut on the fees.
Yes, and like my hair here. Yes,
Gotcha.
Exactly.
Okay, sorry, that was not meant as an insult to you, I assure you. Dr. Heidegger, I want you, if you would, to comment, because we asked the Ministry of Children, Community and Social Services to participate in this program. We hope that they would give us somebody who could come on and discuss this issue with you, and they declined the invitation, which is their right to do. The spokesperson from the ministry also said the ministry doesn't track which dentists provide which services and to whom. And they did send this statement over. They said, we continue to roll out a more responsive, efficient, and person-centered social assistance system that will help individuals and the economy recover from the COVID-19 pandemic. What do you make of that?
I'm not really sure what to make of that.
Does it sound like bureaucraty's gobbledygook to you?
Yeah, I think so. I'm not sure if they were they were wanting to prove that they are looking after the situation without knowing too much what's going on about it.
Which raises the question, Besma, of whether we are too reliant on China. What say you?
Absolutely too reliant, but so is the entire world. That's the challenge. The challenge is everybody is too reliant on China. And again, you can, I think, replace China with a different country at a different time. I mean, interdependency, just by virtue of the concept, is vulnerability. We are vulnerable by being interdependent. And again, things work like clockwork when there aren't pandemics and when there aren't geopolitical challenges and when there aren't climate change. But all of those things are heightened at the moment. And so we haven't even got into the geopolitical challenges that exist with China today. And I would also add that Chinese government is very different than it was previously. We have a leader today, President Xi, that's very nationalistic. He's also talking about dual circulation theory, which is being more independent domestically, so for them to be less interdependent on us. Can you imagine that? And so I think this is all just to contribute to the argument that we do need to think about these things more critically. I think we just sort of had too much faith in globalization and interdependence to our own fault, and now it's time to sort of rethink it. Add to the fact that again, climate change is here to stay, unfortunately. So we need to rethink these supply chains no matter what.
Dan, can we break our dependence on China?
So first of all, I think that the statistic that you have shown, because I actually want to defend globalization to a degree, if you just think about what it did for most of humanity. But the reality is we didn't have globalization. We had a very skewed globalization where the whole world became more and more dependent on one really tiny region of the world, if you think globally. We do not have global production or global supply chain. We have a Chinese dominant supply chains, and that's the problem. And so we need to do something about it. Even if China was the most friendliest, democratic, human-loving nation the world have ever seen, this resiliency in time of pandemic, in time of climate crisis, is just not sustainable. We have to figure out how we create much more resilient, global and regional supply chain. And Canada have to start to have this debate because other countries are already doing that.
It sounds, though, Perrin Beatty, that if we try to pursue those other options, they're all going to be more expensive, or at least hard to do. So what's the incentive for doing them?
Supply. It's that you don't run out of the materials that you need, that you're able, particularly times of crisis, to be able to protect your security and to provide the services that are essential. It's important, Steve, for us to understand here when we use the term global supply chain, that the problem is global. It's not susceptible to being resolved here entirely by Canada acting on its own, and countries around the world are wrestling with the same issue, and businesses around the world are wrestling with this issue. So we need to work in conjunction with others to do this. We also need to look at what elements of the supply chain issues are susceptible to being resolved here in Canada. For example, the issue of truck drivers. Even if you can bring something from China, land it at the Port of Vancouver, even if the Port of Vancouver is open and not cut off from the rest of the country, country, you still need truck drivers to be able to get the product to where it's going. That's an issue that others aren't going to resolve for us. We have to resolve that here in Canada. So we need a very focused effort in terms of what we can do here, and we need to collaborate with other partners to resolve the international aspects. And at the end of the day, there's no question that there are going to be elements of this that are going to be more expensive. But if the alternative is that everything shuts down because we can't get our hands on the supplies we need, that would be the most expensive of all.
Besma, down to our last minute. Can we do this?
We can. It takes a bit of a culture change too. I think we need to start thinking about buying local, thinking about, what is it that we can, consume based on what we can grow in the earth. Maybe we shouldn't be having oranges in the month of November. Maybe it's just, I think, unrealistic, and we should be thinking about squash and pumpkin. I think there are lots of changes that can be done.
That's just some of what we covered this week on The Agenda. For more, including the full conversations, you can visit our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda. And that's it for this Friday, November 19th, 2021. Are Canadians bad at innovation? Monday, we'll find out why imitating the success of other places isn't enough to ensure economic progress here. I'm Nam Kiwanuka. Thank you for watching TVO and for joining us online at tvo.org. Have a great weekend, and Steve will see you again on Monday.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism. Ontario Hubs are made possible by the Barry and Laurie Green Family Charitable Trust and Goldie Feldman. Homecomings can be emotional.
I want to thank the Lord for bringing my daughter home.
Please don't go. You don't even know these people.
Family comes first.
But some homecomings are more complicated than others.
Your father came home on Thursday night and told me that he lost all our money. What?
Your life is enough of a mess to keep you busy for a while.
But what family doesn't have its ups and downs?
We're in the middle of an opiate crisis, Rowan.
You're not welcome here. You're the reason she was taken away in the first place.
I'm not gay. I'm sexually fluid.
Welcome home. To family.
To family.
Unsettled, a TVO original, continues tonight at 10.
Oh my God.
Now the question is, how long did it last? And that was not long.
Discover the human stories behind a war that would change the world.
There was a full-on frontal assault into Fallujah. You don't stop until everybody stops shooting.
الأمريكان أذون الجرح مقلب بعد ما يطيب.
We set up the perfect